Hi, good morning. End of February 2021. I have a special presentation this morning. I'm away from the normal presentation, which is real estate. This is a more medical related presentation because I had a recent incident of my left eye. Blood came out seen on the surface of the white of the conjunctiva, we call it conjunctiva. So it's quite a scary thing for me, and also I'm thinking that maybe this experience of mine can benefit others who are experiencing the same. I did not have any medical attention on this particular incident, as I already knew that over a period of time it will resolve on its own. So let me do the presentation. Those who are not very familiar with this condition, so sometimes you see blood in the white area of the eye. So this thing can happen in more elderly people. However, not life-threatening, and also probably you may want to see your doctor. And this is not an advice. My presentation today, I would like to say that it is not a medical advice, so it's just my own experience for sharing. Let me go in. So hi, subconjunctival hemorrhage, that's the name, medical name. Actually, I name it as bloody eye. So we continue. So this is not a medical advice. Of course, disclaimer for the reason that if you happen to see this to a certain extent, it can be scary. So up to your own evaluation, please consult your doctor. Right. We are actually looking at the name called subconjunctival. So let me just briefly explain when we go on now. So subconjunctival hemorrhage is a hemorrhagic blood coming out. Hemor is blood and then leaking out to the side, which is the white part, not involving the part of the cornea and the pupil. So the summary overview, this one I obtained from Mayo Clinic. So Mayo Clinic is a top leading in the US, top leading clinic in the US. And the picture I also collected it from online. So anyway, it's actually tiny blood vessel breaks or rupture at the area of the conjunctiva, or the white of the eye, underneath the surface of the eye. Conjunctiva, actually this part of the eye cannot absorb blood very quickly. So that means the blood would stay here for a while. So the blood get trapped. So may not be realized also, because it did happen to me while I did not know about it, and my family member, my boys, actually observed the blood and then told me so. Or else I did not even realize it unless I actually go for let's say a mirror or look at myself at the handphone. So this is quite scary also, because one day you find your eye with blood. So sometimes scary in the sense that never happened before. So in part, certainly a person will worry about eye, because eye is actually the window to the world. You cannot see anything, you will be scared. So often it occurs without any obvious harm. However, it may actually progress. Of course, this one determined by doctor. If it is actually going to cause more damage, then probably an assessment by a ophthalmologist or a optometrist would be preliminary investigation done. So how it happen? It can actually be caused by strong sneeze or cough. Usually in the sense that if not so serious, probably no need to treat. So here it says that no need to treat, because Mayo Clinic says it's not myself saying no need to treat, although I did not treat it myself because I was confident that it will get better. So symptom may worry you, of course, and usually it will disappear in 2 weeks, or this particular scenario, as you can see later in my pictures, I resolve it in about 1 week's time. So in a way, it's actually a harmless condition, although it is a break of a blood vessel, which is a condition that normally doesn't happen. So this is my day one. So on the 1st of February, I had a bloody eye. So on the left eye, and you can see quite an amount lah, quite a big amount of bleed lah. So causes as we revisit, not always known anyway, but violent coughing, powerful sneezing or straining, carrying heavy stuff, vomiting, can cause this bleeding in the eye. In some cases, eye injury. Of course, these are foreign particle or foreign action, like a rough way of rubbing your eye, and then or in case of trauma. So trauma means something like hit by something, or there is an accident that some sort of injury is impairing the eye. So anyway, if it's a trauma, then definitely there is a puncture of a vessel, and therefore the vessel lead to the eye conjunctiva. My condition, I feel that although it was a sudden thing, I recall now that in fact I did had some strenuous work, so which is lifting of something heavy. So this was now realized that because it's Chinese New Year, I bought some mandarin oranges and a lifting of these mandarin oranges from the floor of the car. So it was a small space that I have to maneuver. So therefore, I think probably that was the reason I caused this bleed myself. Anyway, jerking your head suddenly, having high blood pressure, wearing contact lenses, experiencing allergic reaction, all may be the cause of the hemorrhagic condition of the conjunctiva, or called conjunctiva, subconjunctival hemorrhage. So this is the closer look, and you can see that there is a accumulation or a collection of blood towards the bottom part of the eye. So risk factors involving this subconjunctival hemorrhage includes diabetes, high blood pressure, containing blood thinning medication. So if a person is taking maybe anticoagulant or blood thinning medication such as warfarin, all these are used in aspirin especially. All these are used in heart disease patients. So these are conditions where blood easily leak out because it cannot clot. And also some of the cases of blood clotting disorder where blood become easier to leak out of the blood vessel. So if there is a puncture or little bit of break at the blood vessel, then it happen. So my scenario is I don't have diabetes, I don't have high blood pressure, but I do have high cholesterol. So high cholesterol not listed here, but quite related to blood vessel being, and undergoing hardening. So which is actually arteriosclerosis. So if you have diabetes, high blood pressure, high cholesterol, and then these are risk factor for cardiovascular disease because your blood vessel get hardened. So arteriosclerosis, and therefore easier to break. So when there's a hole or a high pressure area, so the area of the blood vessel may be unable to hold the pressure and therefore give way, which breaks into the white of the eye. So this is day 2. It seems like better off than day 1. And then the day 2, a closer look, seems like there is some color change, maybe a darker color. And I think that just to continue to mention about complications. Well, the complication for this kind of scenario I have read in the internet, not so common, rare complication. But if it's trauma, especially there is an accident or you are involved in an accident which may have caused this bleeding, then it is better to check more thoroughly in case of other complication or injury, especially like in car accident or motorbike accident, a person fell down, and then this may have a problem of the hitting the ground, then the eye may be injured, and also the brain or the cranial scenario of concussion, they call it lah. Of course, in the aspect of medical words, is concussion lah. So MRI would be useful to diagnose any bleed in the brain. Anyway, prevention would be to reduce the likely leak. So therefore, the bleeding disorder, all these thinning medication, if it is found to be the causing agent, then to prevent it is to titrate or reduce or however to minimize that risk. Of course, if there is an injury causing it, and then therefore identify a type of injury which can cause this bleeding, then this causative agent should be removed. So rubbing of the eye is one of the reasons. Maybe it injure the blood vessel, therefore rub the eye gently. Too hard may cause a minor trauma. So this did not happen to me because I did not have any irritation, so I did not rub, but just because I was carrying heavy stuff from the lower ground. So for me, third and the fourth day, you can see it in fact clear away, and then fifth day it quite clear up, only a part of a yellowish whitish type of leftover. So recovered in about 6 to 7 days, and the normal days of how long it takes to recover in the search in the internet is about 7 to 10 days for subconjunctival hemorrhage to resolve on its own. And truly, I did not have any medical intervention. I did not go see a doctor. I did not actually use any medication or eye drop. I only left it as it is. So of course, not to rub the eye, but I observed similar way of carrying the eye like a normal person, rest, less strenuous reading, and also take a bit more sleep. As the blood gradually disappears, then the affected area may change color, which is in my case a bit of yellowish. I think that is the remnants of the red blood cell clearing away. So the 7th day, on the part that I think in the white big patch of the blood actually clear off on the 7th day. Right, of course, there was a lot of fear in case that you would ask me about the psychological part. Of course, there's a lot of fear because eye is a very important part of our body. So, of course, anyone can be understood that this condition happens. If the first time for you, it will be very scary. Anyway, for me, it was anticipated to clear off, and of course, I actually had a few incidences. I observed this in my family members and friends. So this is to me not a very new thing. So maybe for that reason, I was not so scared. So nobody actually is invincible to have this fear of having a bloody eye. But then individuals respond. Of course, individuals respond to this concern, and also to mention that all of us are invincible unless we are God, which none of us is. None of us is God, so therefore we are accepted to be fearful of this happening. In case you happen to see, in case you do come across this happening among your friends and relatives, do share with them this knowledge. Right, my conclusion is that I have been actually seeing before my own experience of seeing this condition of bloody eye in two consider close family members. One is my childhood time when my father's friend, we were visiting my father's friend's place, and then we saw him having this condition at that time. I remember very vividly. Then second, I also saw it in my father, because my father is an elderly person who also had high cholesterol. So this probably is genetic. Anyway, when you happen to see condition like that, of course, the first thing is to see a doctor and also to get more knowledgeable about it. So internet knowledge is important, and also because I was personally involved with my pharmaceutical career for 20 over years. So seeing patients and seeing condition like this may be not so scary. So I was able to hold on before I just rush to an emergency unit. But for you, if you have concern on getting worse, then please go to your doctor to ask for medical advice. This sharing is not a medical advice. It's just for normal knowledge for you to know that if in case this happened to your family members, you are not so shocked. Anyway, thank you very much for following this presentation. I'm available at this number and also my websites. Thank you very much.